My name is Theresa Anokam from Brown University, California. I am a psychiatric mental health nurse practitioner student. What we are about to watch is an integrative psychotherapy video, segment 1. Cindy is a 38-year-old African-American female who presented to the psychiatric mental health nurse practitioner office 2 weeks ago with complaint of depression and anxiety, which started 4 months ago as she is going through separation process of 20 years of relationship with her husband. In addition, her husband's relative constantly criticize her whenever they are around. She stated that the separation process and criticism from her husband relatives make her sad and anxious. Cindy stated that she has no interest in anything, no longer go to gym for exercise, which she initially liked to go and enjoy, which used to be her passion. She also has problems staying asleep, no energy to get out of bed in the morning, her body hurts, she's so irritable, sad, anxious when her husband's sister is around. She constantly argues with her husband. Her husband has been abusing alcohol. She also believed that she is no longer loved by her husband and not important to her husband, and she was recommended by her medical doctor to follow up with the mental health provider. Cindy is alert and oriented to time, place, and the situation. She denies suicidal ideation, homicidal ideation, interacted appropriately but minimally with this provider. She has a depressive mood with congruent affect and was anxious. She has a past history of sexual abuse by her uncle, physical and emotional abuse by her father. She denied history of head injury, and she denied substance abuse history. She also stated that her husband may be losing his mansion house since he lost his job 2 months ago. She also has stated that her husband drinks a lot since the death of his mother 5 months ago. Cindy believed that she is not important and not loved by her husband. She reported having no family support in the community and denied having current psychiatric treatment. Cindy was informed about 3 treatment psychotherapy modalities that will help her develop insight and a solution to her problem. No additional concerns were identified. Identified key core belief. Cindy believed that she is not important and not loved. Specific problem or issues identified. Based on cognitive behavior therapy standpoint, Cindy has depression, which is related to the core belief that she's not important and not loved by her husband. She also has anxiety related to her husband's sister constant criticism of her. The goal identified by Cindy at the end of the goal identified by Cindy at to end marriage problems by stopping constant argument, also to stop their separation process. Treatment therapy will be successful if Cindy and her husband stop argument. Cindy being able to feel loved, feel appreciated, and feel important. The perpetuating key factor of the dysfunctional assumption is that Cindy's husband criticism of Cindy when she visits them, and also Cindy's husband not supporting Cindy by not cautioning his sister to stop criticizing Cindy. Speculated experiential problem contributing factor from Cindy's past may also be driving Cindy's current symptoms, as her parents divorced when she was 12 years old. She was sexually abused by her uncle. She was physically and emotionally abused by her father, and she has no support system in the community. Cindy has history of vulnerability as she was sexually abused as a child. Cindy also was physically and emotionally abused by her father. Her parents were divorced when she was a child. In addition, she witnessed violence when her mom and her dad had physical altercation. Cindy's family has a significant history of alcohol abuse. Anticipated end benefits of that Cindy will derive from therapies include change of Cindy's core belief of feeling that she is not loved by her husband. She will get her feelings communicated without any argument. She will also have a physiological improvement for her tiredness, pain-free, increased appetite, increased libido, and she will sleep much better. DSM-5, depressive mood, anxiety disorder. Condition, good. 3 treatment psychotherapy modalities identified that will benefit Cindy will be cognitive behavior therapy, interpersonal therapy, experiential therapy. These 3 therapies are chosen because each one of them have the great potential to help Cindy develop maximum insight and solution to her problems. Cognitive behavior therapy. The use of cognitive behavioral therapy is to target negative thoughts, while behavior therapy helps the client to overcome problems by changing her behavior. For instance, one common technique to treat anxiety disorder is desensitization, in which a client is gradually exposed and asked to imagine anxiety-inducing situations as a way to become more comfortable with them. Behavior therapy is frequently paired with cognitive therapy. In the cognitive behavior therapy, a general term that refers to various methods that integrate both techniques. Interpersonal therapy. In interpersonal therapy, this is appropriate intervention therapy to use because there is identified interpersonal conflict and lack of social support causing clients depression. In interpersonal therapy, which is a brief and focused like cognitive behavior therapy, clients closely examine their relationship with the family, friends, co-workers, and other key people in their lives with the goal of resolving interpersonal conflict, improving communication, and building a more solid support network. As part of the treatment, the client will be asked to create an inventory of important relationships and role play with these therapists. Experiential therapy. In this therapy, clients will learn to distinguish healthy emotional responses from those that are misguided or harmful. But unlike some types of therapy in which the client-therapist relationship is strictly neutral, experiential therapy is characterized by the supportive, empathetic relationship that the therapist cultivates with the patient. If the patient who is being treated feels understood and feels warmth from the therapist, these factors of course, will be a large part of what makes the person get better. These 3 treatment modalities will be beneficial to Cindy who is from different culture, as cognitive behavior therapy will target on negative thought with the aim of desensitization. Interpersonal social relationship will change to positive, and client from and this also will help Cindy, as she's from different culture, to distinguish healthy emotional responses from those that are misguided and harmful from her original culture. Relationships. Segment 2, treatment plan 1, patient and client cognitive behavior therapy. Good morning, Miss Cindy. How are you today? As we discussed last week about using 3 psychotherapy treatment modalities to manage your identified problems of depression and anxiety, we will first start today with cognitive behavior therapy.
Okay.
As cognitive behavioral therapy targets negative thoughts, behavior therapy can help you overcome problems by changing your behavior. For example, one common technique to treat anxiety disorder is desensitization, in which you will gradually be exposed to or imagine anxiety-inducing situations as a way to be more comfortable with them. Also, the use of cognitive behavior therapy is to restructure your belief of feeling that you are important to your husband. I want you to write one of the on the journal that I gave you, the evidence that make you feel that you're loved, and also the evidence that make you feel that you're not loved. And next week we will apply, we will discuss that in details, and we will apply interpersonal therapy for your treatment modality again. Okay?
Okay.
Do you have any questions for me?
No.
Okay, see you next week. Treatment segment 2, provider and client interpersonal therapy. Good morning, Miss Cindy. Last week I asked you to write on the journal I gave you the evidence that make you feel that you are loved and you are not loved. Let us review the journals. Wow, you did good. You're on target. Are interpersonal conflicts and lack of social support causing your depression?
Yes.
If so, interpersonal therapy will be the right therapy for you. In interpersonal therapy, which is a brief focus like cognitive behavior therapy, I want you to closely examine your relationship with your family, friends, and other key people in your life. As part of the treatment, I would also like you to create an inventory of important relationship, and I will have a role play with you. Okay?
Okay.
Do you have any questions for me?
No.
See you next week. Segment 4, Treatment Plan 3, Provider and Client Experiential Therapy. Hello, Miss Cindy. How are you today?
I am feeling much better today. Thank you.
Did you closely examine the relationship of your family, co-workers, and other people in your life that I told you last week?
Yes, I did.
Did you practice emotional regulation that I taught you last week?
Yes. I stayed calm when my husband's sister and brother were criticizing me. I did not respond to them to defend myself. I did not argue with my husband.
You are on top of the game. Do you feel less sad and less anxious?
Yes, indeed.
Today we'll be discussing experiential therapy, which is the third and the last on the list. In this type of treatment, you will learn how to distinguish healthy emotional responses from those that are misguided and harmful. Healthy emotional responses is staying calm, being non-defensive. They will help you act in a more responsible manner, which will help result in a better relationship, reduce symptoms and depression and anxiety, and create a better well-being.
Okay.
Unlike some of these therapies that are strictly neutral, experiential therapy is very supportive of the patient. I hope you feel better as you embrace this therapy.
I really appreciate how you listened to me, how you put yourself in my shoes and understood what I was going through. I feel like I'm getting better already.
It is my pleasure to work with you. Have a nice day, okay?
Thank you.